As a diagnostic radiologist, I look into bodies all day long, and this is what I see. We live in such an unhealthy society that it is common to see scans that have findings that only relate to the presenting illness. What do I mean by that? Let's say that you're 50 years old and you have a nagging pain in the left lower part of your abdomen for the last few days. You've tried to ignore it, but it just keeps getting worse and worse. You go to the ER. You may have a bit of a fever, and your white blood cell count may be a little elevated, but your urine is clear. The doctor checks you out and finds that you are tender in that part of your abdomen, so he orders a CAT scan. Any doctor worth their salt already knows what you almost certainly have, and the case could be made that the CT scan is superfluous. But hey, this is the USA, and no stone goes unturned when it comes to making a diagnosis. When I worked as a family doctor in Canada between 1990 and 1993, for all intents and purposes, there was no access to a CT scanner, so the diagnosis was made entirely clinically. So some of the things that we have come to think of as essential in modern healthcare really are not. Perhaps that is a subject for a future video. Nonetheless, the CAT scan gets done and it confirms that you have diverticulitis of the sigmoid colon. The sigmoid colon is that part of the large bowel before the rectum that is shaped a bit like an S. And diverticuli are little outpouchings of the colon caused by the colon straining too hard to push the feces through. This leads to local weakenings of the bowel, such that the inner lining of the colon pouches out, forming these little pockets or diverticuli. The accepted etiology is chronic insufficiency of dietary fiber. I've said it before, and I will say it again. The vast majority of people in the U.S. are chronically deficient in fiber. According to the U.S. government standards, which are probably too low, only 6% of women get enough fiber, and rounded to the nearest whole number, 0% of U.S. males get enough. That means that the overwhelming probability is that every single male that you know is deficient in fiber, which protects against both gastrointestinal malignancies and non-gastrointestinal malignancies, as well as a host of non-cancerous illnesses from heart disease to dementia. With that few people getting enough fiber, why does everybody seem to obsess over getting enough protein when almost everybody gets twice as much as they actually need, and almost nobody gets enough fiber? But I digress. The suffix itis, added to diverticuli, means inflammation of the diverticuli. This can lead to an abscess and even sepsis or death. I've seen people form tracts from the abscesses to their urinary bladder, such that they pass gas from their urethra and feculent urine, meaning that you could literally end up farting out your penis and peeing out poop. Yuck. I've seen tracts form from the umbilicus such that they have the abscess drainage coming out of their belly button. I sure hope that they thought that those cheeseburgers were worth it. For me, I think I'll pass and stay on my high-fiber plant-based diet. Let me get to the main point here. You may have had a scan done to confirm the presence of diverticulitis and exclude a complication like an abscess. But what is uncommon that this is the only finding on the scan relating to a lifetime of poor diet. Almost everybody north of 50 has visible calcified plaque in the arteries of the heart. An abdominal CT will catch the bottom of the heart, so it is very common to see these calcified vessels. With as many as 40% of Americans having fatty liver disease, it is so common that I fear that the ordering physicians become complacent when I mention it in my reports. Fatty liver disease is a precursor condition for liver cirrhosis and liver failure, along with being associated with higher rates of cardiovascular disease and diabetes. Gallstones are a dime a dozen. Most gallstones are caused by excess cholesterol supersaturating bile, such that the cholesterol crystallizes in the gallbladder, leading to stones. Kidney stones are super common and largely caused by diet through multiple mechanisms. When they move from the kidney into the ureter, which is the passage from the kidney to the bladder, you can end up in a world of hurt. Kidney stone pain may be one of the worst types of pain possible. Patients are commonly writhing in agony. I know, I've been there before I adopted a plant-based diet. Calcified plaque is common in the arteries of the abdomen and pelvis. Close to 80% of patients have too much body fat, which obviously also shows up on the scan. And the bones may lack density for consuming a chronically acidic diet, leading to ongoing leaching of calcium from the bones. These are all very common conditions. There are a dime a dozen. But why are they so common? Well, the reason is simple. They all have a common cause, which is poor diet with excessive animal products and junk food. And that is why if you see one of these diseases on a scan, it is also likely that you will see others as well. If you don't want these diseases, you must break away from societal norms and do something different, which is to eat a whole food, plant-based diet.